I'm going to talk about the physiological effects of ultraviolet radiations. Now, when talking about the ultraviolet radiations, in previous classes, I have told you that ultraviolet radiations are the radiations which lie in the wavelength of 10 to 400 nanometers, and basically they have three bands: UVA, UVB and UVC. UVA has a wavelength of 320 to 400 nanometers. UVB has a wavelength of 290 to 320 nanometers, and UVC has a wavelength of less than 290 nanometers. Then we have talked about the different generators that produce the ultraviolet radiations, like high pressure mercury vapor lamp. Then we had the chromium lamp, fluorescent tube, Tickenining tunnels. So we have talked about all these aspects earlier. Now today I'm going to talk about the physiological effects of ultraviolet radiation. So first I'm going to talk about the immediate effects of UVR on the skin and other structures, and then I'm going to talk about the long-term effects. So if we talk of the immediate acute effects of UVR on the skin, then the first thing which happens is the erythema. Erythema is the reddish discoloration of the skin, which you can see. So UVR basically causes reddening of the skin. UVB and UVC are basically absorbed in the skin, which causes release of substances such as histamine and prostaglandins from the keratinocytes. And these substances, also there is release of nitric oxide. All these substances, they act as vasodilator. Accumulation of these substances around the blood vessels in the skin make them to dilate, which leads to formation of erythema or the reddening of the skin. So basically, जितना ज़्यादा histamine produce होगा या histamine like chemicals produce होंगे, sooner and intense will be the reaction. So you can say that greater the quantity of histamine like chemicals produced, the sooner and intense is the reaction. And it has been seen that about 20 millijoules per centimeter square of 300 nanometers of UVB exposure is required to produce minimal erythema in a fair-skinned individual. Next effect, what we see is the pigmentation. Now, pigmentation develops in 2 days of irradiation of UVR. What happens is that UVR stimulates the melanocytes in the skin to produce melanin, which is then passed to the adjacent numerous cells. So basically the melanin forms like an umbrella over the nucleus of the cells to protect it from the UVR pigmentation. Now this pigmentation, which is happening because of the production of the melanin, it substantially reduces the penetration of the UVR waves. So basically, this is here. If you see this slide, here I have shown that how the exposure of the single UVR is causing redness. So this is, I hope this is visible to you all, this slide.
Yes, ma'am.
So here you can see that immediately when the UVR exposure is given, so what happens is, this is the epidermis which has been shown, and this is the dermis layer. So there is redistribution of melanin. It forms a nuclear cap. Okay, so you see This is the redistribution happening over here. Now, when this exposure keeps on happening, this spreads to the adjacent cells, and there is increased activity of the melanocytes, and repeated exposure leads to more dendrites along of the melanocytes, and there is accelerated melanin transfer to the keratinocytes. So basically there is increase in number and activity of the melanocytes, and also there is increase in number and size of the metasomosomes. So this is how the melanin production happens. And this leads to pigmentation. The other thing which happens is another effect, which is the thickening of the epidermis, or we can say that there is increased skin growth. Now what happens is the irradiation of the skin with UVR increases the activity of the basal layer of epidermis, and it causes a marked thickening, particularly of the stratum corneum. This stratum corneum is the outermost layer, and this layer may get as much as 3 times thick as its normal thickness. The skin thickness gives protection from the pigmentation. So greater the skin thickness will be there, lesser will be the pigmentation. But it usually fades in 4 to 6 weeks. Next acute effect which UVR has on the skin is the peeling or desquamation. Now basically the increased thickness of epidermis is eventually lost as squamation. So there is loss of cells in desquamation happens. And when this happens, the resistance of skin to UVR is substantially lowered. Another effect which UVR has on the body is the vitamin D production. In the presence of ultraviolet radiations, 7-dehydrocholesterol in the sebum is converted into vitamin D. So here 7-dehydrocholesterol, which is there in the sebum, it is converted into vitamin D. Here in the cycle, I have shown you how this is happening when vitamin B exposure is given, what is happening to vitamin D. Okay, so it is converted into vitamin D, that is calciferol and cholecalciferol in the skin. Why is vitamin D basically needed in our body? It is needed in our body for absorption of the calcium. It is needed in our body for absorption of the calcium. So when a person, that is why it is said that exposure to sunlight is important for vitamin D production. And if vitamin D is in adequate amounts, it is necessary, which plays a very important role in absorption of calcium. And calcium is needed for formation of bones and teeth. The next effect which UVR has is on the eyes. Strong doses of ultraviolet radiation B and ultraviolet radiation C to the eyes can lead to conjunctivitis. Now, conjunctivitis is basically the inflammation of the tissues over the cornea and the lining of the eyelids. It can also lead to photokeratitis. Now, photokeratitis is the inflammation of the cornea. This can result in irritation of the eyes, watering of the eyes, and can lead to photophobia. This is also known as snow blindness when it arises due to solar UVB and UVC radiations. Reflection occurs from the snow. Also, the strong exposure, we should say, the strong exposure of UVA can lead to cataract. So these all effects on eyes UV radiations can have. Then next effect which are seen because of the ultraviolet radiations are the long-term tonic effects of ultraviolet radiations. So long-term effects में जो सबसे important effect है that is the solar elastosis and aging. It is always said that exposure to the sun can cause wrinkles and it can cause aging. This happens because prolonged exposure over many years to strong solar ultraviolet radiations can lead to premature aging. It can lead to thinning of the epidermis, loss of the epidermal ridges, loss of the melanocytes. There can be dryness of the skin, which can be because of the poor function of sebaceous and sweat glands. There can also be wrinkling of the skin. Wrinkle formation can be there, and that will be mainly because of lack of dermal connective tissue. So these effects are often seen in fair-skinned races more who live in very sunny climate like South Africa. So premature aging is one of the long-term effect which individuals who have a greater exposure of UVR can have. The another effect is that the exposure to the ultraviolet radiations is that it can lead to carcinogenesis. So it is not that it is not an acute effect. It is prolonged exposure of these UVB and UVC rays can lead to carcinogenesis because these rays have effect on the DNA. And because they have an effect on the DNA, they have effect on the cell replication. So it is said that prolonged exposure of the patient's skin to the stronger UVR radiation should be avoided. And when we are giving the treatment by UVR radiations, it is said that the course of the treatment should not exceed for more than 4 weeks. So these were the physiological effects of ultraviolet radiations, which we need to see. I hope the effects are clear.